My name's Georgia Black, and I'm a Principal Research Associate at UCL in the Department of Applied Health Research.
My name is Sandra van Os. I work at UCL in the Department of Applied Health Research, and I'm a research associate there.
We know that for some people with lung cancer, their journey to a diagnosis can be quite complicated and can involve multiple visits to either a GP or other healthcare professionals before they're referred and their cancer is diagnosed. And one thing that GPs can do to try and reduce delays in that process, which may be inevitable, is to engage in something called safety netting.
So in this project, we've talked to patients and GPs to look at what happens when patients first come in, they see the GP with what we call low but not no risk symptom. So it could be anything from a cough and those sort of respiratory symptoms. And they could be indicative of lung cancer, although that is very unlikely. So in those cases where a GP thinks it is probably nothing serious, but I need to make sure that this patient comes back just in case things get worse or they don't get better. So what do GPs do to encourage that? How do GPs explain that to patients? And what's the patient's perception after the consultation? Have they understood the advice that the GP has given them? And do they feel encouraged to make another appointment if things don't get better?
So for some cancers, symptoms are really easy to spot and easy for patients to spot, crucially. Unfortunately, for lung cancer, the patients normally experience symptoms that could easily be attributed to a different type of disease. So they're things that can feel quite normal, like having a cough or feeling tired. And so patients quite often attribute it to something that isn't worrisome, but also GPs. And that's the right thing to do. You don't want to send every patient with a cough for an X-ray or a scan. And that wouldn't be good use of NHS resources, and it wouldn't be safe for the patient. So safety netting is a way of ensuring that patients with those low risk symptoms are followed up until we know whether or not it's a cancer.
People still slip through the net. So there are still people, particularly in lung cancer, who are diagnosed late. And so we want to make sure that people who have those low risk symptoms, but that end up being diagnosed much later down the line with lung cancer, come back sooner. And so reducing those delays is absolutely crucial, and safety netting is one important way of doing that.
We hope that by doing this project, we're going to find out what good practice looks like in terms of safety netting and give GPs some recommendations about what they can do to make sure that patients remember and take their safety netting advice.
So those are the techniques that GPs use to encourage patients to come back if things don't get better or get worse. I always think, yes, but what's the patient's point of view? So does the patient actually understand what the GP has told them? How has it left them feeling? Do they feel and think about their symptoms differently?
In my opinion, the way to ensure some consistency and high quality in safety netting and in other safety measures in primary care, you can't be too reliant on one individual. You can't put all the risk with one individual. You need to find strategies that distribute the risk. And this could be between the GP and the patient, but it can also be between the GP and other members of the practice. So, for example, some safety netting strategies that use electronic record systems, for example, to remind the GP that they've sent the patient for a test or that they're due for a follow-up consultation, can really help spread the distribution of responsibility so that more people are looking out for those patients who've fallen through the cracks.